Hello everyone, Dr. Sutter Caton, physical therapist here with Vive Health. I'm looking forward to sharing all my knowledge with you and I hope you enjoy. So this exercise is aimed to improve pain and stiffness, pinching when you have a shoulder impingement. So it's a technique that we use in physical therapy a lot called mobilization with movement. We're going to use the band today to simulate what your therapist might be doing in person, but it's a technique you can perform at home. So what you're going to do is step your foot onto the band, and then I'm going to loop it around my shoulder. I want to be just off the edge of my acromion. So if you feel the top of your shoulder, you can feel that bone at the very top. I want to move off of that so I'm on the shoulder bone itself. I'm on the humerus of the arm and not on the acromion. So what this band is doing what we call an inferior glide. So it's pulling my humerus down. And so what we find with people with shoulder impingement is their shoulder is lacking that motion, that movement as they raise the arm up. The arm doesn't have that inferior glide. And so that's where you get that narrowing of the space you mentioned in my previous video, and you can have that pinching or impingement occur. So I have the band there, and once it's there, I'm gonna add the with movement part of the technique. So I'm just gonna nice and easy bring my arm up by my side. What you'll find is that you can bring the arm a little higher without pain than you could without this band. So I'm raising it up. And what you'll find is after a few repetitions, you might be able to bring it a little bit higher than you previously could. So this is the same thing I would be doing with you in person if I was your physical therapist. It's something you can perform multiple times a day to help reduce pain. You can do it prior to other exercises. So I would do this 10 to 15 times throughout the day as symptoms dictate. So next I'm going to show you a couple isometric exercises that are really important and great to do early on when you're having shoulder pain and impingement, a partial rotator cuff tear. So the next exercise I'm going to show you is an isometric for the shoulder. So it's a great one to start out with when you have a partial rotator cuff tear, an impingement, or any sort of shoulder issue. So it's a nice low load, safe technique to start working those muscles and strengthen them and reduce the pain. So an isometric exercise just means we're contracting the muscle, but it's not moving, meaning it's not shortening or stretching. So what that looks like is I'm going to resist myself with my hand on my elbow. So if my hand wasn't resisting, the motion we're trying to do is to bring that arm out to the side, what we call abduction. What I'm gonna do is resist myself with my other arm right on my elbow. So these are pretty gentle. You shouldn't be trying to go as hard as you can. I would say like a 2 to 3 out of 10 as far as effort. So I'm gonna put my hand there. I'm gonna push my elbow out into my hand. And what we're gonna do, what we found, the research says is really great to load those tendons isometrically, is 10 holds of 10 seconds. So that's probably about 10 seconds. I'm gonna take a little break and I'm gonna go again, pushing out. Remember, if my hand wasn't there, my arm would be going out to the side. I'm gonna hold once again for 10 seconds. And you would repeat that until you get to 10 repetitions. That's a great way to reduce pain too. So if you're still trying to play a sport or lift weights in the gym or exercise, that's a good one to reduce your pain prior to doing those things. It's also a great low-level way to start strengthening those tendons. Another direction you can do is flexion, so out in front of me. So I'll turn to the side so you can see. So if my hand wasn't resisting, we'd be going up like this. I'm gonna put my other hand up against my fist. I'm gonna push into my hand with my fist, hold for about 10 seconds once again, and relax. So remember, we're gonna repeat that 10 times and holding for 10 seconds. And I would do that throughout the day to reduce pain and start strengthening those muscles. This next exercise I'm about to demonstrate is called the banded pull apart. It's a great general one for the shoulder, but really important when you have an impingement or a rotator cuff tear, because it starts to strengthen what we call the scapular retractors, or the muscles responsible for pinching those shoulder blades together behind your back, which is really important for posture and really puts that shoulder in a better position to perform and takes the burden off some of the other muscles. It's also important for developing the strength of the external rotators, which are often weak when we have shoulder injuries. So I'm gonna turn to the side so you can get a better view. I'm gonna take my band, I'm gonna start with an underhand grip on the band, And we're gonna start with the band about eye level. So it's about eye or forehead level. And then what I'm gonna do is pull that band apart as I bring it towards my chest. So there's a little bit of a angle with the exercise. It's gonna start up high and finish down low. As I'm pulling that apart, I'm thinking about squeezing my shoulders together behind my back. So I'm pinching there and I'm controlling both directions. So I'm coming here slow and controlled, and I'm letting it come away. I'm not letting it just kind of rebound back together. I want to control it both ways. So you're going to decide what difficulty you want to perform the exercise with based on the thickness of the band you use, and also I can take my grip a little narrower if I'd like and make it a little more difficult that way. Another thing to make sure you're not doing is getting excessive motion or arching from the lower back. So if you're using something that's too heavy, or if you're not really conscious of your form, what a lot of people want to do is arch the back and think that's how you perform the exercise. We want to make sure that the only thing moving is the shoulders and the shoulder blade. So that's the only thing that's moving. I'm thinking about kind of keeping my midsection braced and everything else still as I perform the exercise. I would perform this one 10 to 20 times for 2 sets, once a day. So this next exercise is for those that want to continue with their weightlifting or with their strengthening of the exercises for the shoulder, work on the muscles of the shoulder while working around an injury, and also building the strength to reduce the risk of an injury and rehabilitate from that injury. So you'll see a lot of people perform front raises or lateral raises in the gym, meaning they come straight out to the side in a lateral raise or straight out in front. Those can tend to be problematic if you have an impingement or other issues of the shoulder. So what a good direction to do it in is 45 degrees, or what physical therapists what we refer to as the scapular plane. I mean, it's the same angle that the shoulder blade and the humerus of the arm line up as. So what this is gonna look like, it's gonna be more 45 degrees out to the side. So I'm not straight in front, not out to the side, I'm right in between. There's a few different grips you can perform this in. The most shoulder friendly is gonna be a palm up grip. So with my palm up, I'm gonna bring that right out to the side, as high as you comfortably can. I wouldn't go too much higher than shoulder height. You can then try a neutral grip. So now my thumb is pointed up towards the ceiling. The most problematic, and one I wouldn't try if you're having shoulder pain, is a thumbs down or a more of a palm down internally rotated grip, because this is gonna put that shoulder in the position where it's more likely to get impinged. So that would be this grip. So this is a good way to keep working those shoulders and working around an injury. I would do it with your typical sets and reps that you would use in the gym for developing strength or building up the size of those muscles. So this is something I would do maybe 8 to 15 times with a moderate weight. And if you're doing it with heavy enough, I wouldn't perform this more than every other day for 2 to 3 sets. So the next exercise I'm going to show you is a great way to improve the strength of the external rotators of the shoulder. So remember, as I mentioned, a lack of external rotation strength can predispose someone to developing shoulder impingement and also just contribute to weakness of the shoulder. So this is a great exercise to improve the strength and prevent those injuries. So I'm gonna lie on my side. I'm gonna have the dumbbell in the working arm. My elbow is gonna stay by my side the entire exercise, so I don't want it to wing out. The traditional and the way I would start performing this exercise is, one, I would use a lighter dumbbell, so maybe just a few pounds depending on your strength. And I also want to just perform it like we normally perform exercise. So the amount of time I spend going up is about the same amount as I spend going down. So this exercise, I'm rotating the arm up only as far as I can from the shoulder joint, meaning I'm not rocking my whole body to try to get the weight up, and the elbow is staying by my side. So I would start there for maybe 10 to 20 repetitions with a given weight. Once you've done that a little bit and developed kind of a starting level of strength, we're gonna add a component of increasing the amount of eccentric time spent in the exercise. So the eccentric component of the exercise is after you've lifted the weight up, I wanna let it down fairly slowly. So I like to use a 5-second count. So I'm gonna lift up and I'm gonna let the weight down slow. 3, 2, 1, back up, 5, 4, 3, 2, 1. So adding additional time to the eccentric portion of the exercise is a great way to build up even more strength, muscle, and neuromuscular control of that muscle. It's not the one I would jump into first because you can be a little bit sore from doing the exercise compared to doing it normally. And once you're doing additional eccentric time, I would lower the reps down to 8 to 12 repetitions for 2 sets. And I would do this no more often than every other day to allow the time for the muscle to recover. Up next is a great exercise to improve your thoracic mobility or the upper back. So this is important when we look at shoulder impingement and just overall posture, and contributes to a lot of other aches and pains that we have, is having a lack of mobility in the upper back. But really when it comes to shoulder impingement is having those shoulders be able to roll back further and getting more extension out of the thoracic spine takes a lot of the burden off the shoulder, so we don't get as much of that pinching, catching in the shoulder joint. So what I'm gonna do here is I'm gonna be on all fours, and it's gonna look, if you're familiar with yoga, it's gonna look a little bit like a cat-cow exercise or pose, but it's a little different to bias the upper back. So I'm gonna start in hands and knees, but then what I'm gonna do is allow my butt to sink all the way onto my heels. So what this does is it locks out my lower back a little bit. So as I'm doing this exercise, I'm getting most of the movement from the middle and upper portion of my back. From there, it's how you would expect your normal cat-cow pose to be if you're familiar with them. I like to teach it a little different way. So what I'm gonna do, I'm gonna think about pushing my hands into the ground to round my lower back, tucking my chin towards my chest. Like I said, pushing with the arms adds a little bit extra to it. Now I'm gonna go the opposite way. So I'm going to imagine I'm sinking between my shoulder blades as I follow with the head and the neck, and now I'm trying to arch my upper back as much as I can, and then we're gonna flow between them. So you can see by my position is almost all the movement is coming from the middle and upper back, and really not much is coming from the lower back. But ideally, you're gonna perform this exercise until you notice a change. You feel like you're moving the upper back easier with less stiffness, so that can go up to 20 repetitions, even a little bit more. It's not like you're gonna be sore from this exercise or that we have to worry about allowing muscles to recover. I would like it performed throughout the day instead of just once. So I would definitely suggest 1 round in the morning after you wake up, 1 round in the evening before bed, and then maybe another round of 10 to 20 scattered somewhere in the middle of the day. So this exercise that I'm about to show is a great way to improve the strength and mobility of the shoulder blade. As I mentioned before, the shoulder blade actually makes up a good portion of arm range of motion. So when we think of range of motion coming just from the shoulder, about 1/3 of that is also coming from the shoulder blade as the arm goes either further up or overhead. So this exercise is to target a muscle called the serratus anterior. And so this muscle attaches from the underside of the scapula, the shoulder blade, and runs kind of alongside the body and attaches to the ribs. What this muscle does is allows the shoulder blade to slide or upwardly rotate as it's supposed to during exercise. So how this is performed, I'm gonna show you the kind of the easy way to start. So you're gonna assume basically a push-up position, and you can start on the knees because going straight into on the feet can be a little tough. I'd rather you learn this exercise first before we try to make it too tough. So once I'm here, the arms are gonna stay straight. It's not like a regular push-up. What I'm gonna do is sink between my shoulder blades, or think about pinching my shoulder blades together. And then I'm gonna go the opposite way. I'm gonna push my arms into the ground. I'm gonna think about spreading my shoulder blades apart. And then we're gonna go back and forth. So I'm pinching, and I'm spreading the shoulder blades apart. You can see my arms are staying straight. My back is staying in relatively the same position. as we go back and forth. It shouldn't be terribly tough. It's more an exercise of motor control, so I want you to really get a feel of those shoulder blades moving. We want to make sure we're not shrugging, so people have the tendency to allow the shoulders to come by the ear when they're doing this exercise, so I want to pull those shoulder blades down as I'm doing this exercise. If that's fairly easy to perform 10, 15, 20 repetitions, easy way to make it tougher is to go onto the feet instead of the knees, and it's going to be performed the same way, just now we have more of our body weight. So I'm pinching the shoulder blades together, I'm pushing them apart, thinking about pushing my hands into the ground. I hope you found the video helpful, and thank you for watching.